Oh, there we go. Finally, sheesh kebab. How are you? Um, yeah, I was not able to broadcast. I don't even know what it was. It wasn't the internet, whatever. And I'm not sure if we have a title going on up there. Yeah. Today is Nurse Nurse Week. National Nurse Week in general is in May, but this is just for the ER nurses. So I thought we need to appreciate them with the rest of the nation that nationally appreciates ER nurses. I don't know what they do. I don't know if it's like Valentine's Day and you send cards. When I was clinical and in the hospital, different vendors would maybe buy us lunch that week, or, the hospital, if you are wherever you're working, they might give you, some token of appreciation, a coffee mug or a pin or whatever. But honestly, those things are they're nice, but to be appreciated in general and for people to be kind and considerate on a daily basis, to me was much more worthwhile. But it is National Nurses Week, and it gives us that opportunity to think about all the things that an ER nurse is. And a lot of times people are asking, what does a travel nurse do? And a travel nurse does everything a nurse does, right? Just so it doesn't matter if you're an RN or an LVN, a CNA, if you're a radiology tech, the duties you perform are still the expectations if you're a traveler. Very, very similar expectations. So let's just start real quickly with the ER itself, right? The emergency department, actually, for years we called it the emergency room, but it's actually an emergency department. It's its own entity department of the hospital. It, of course, interacts with other departments such as labs and the radiology department, the surgical department, the surgery, the operating rooms, and so forth. But it is like its own life down there, right? So down there, I don't know, down there. It often is on a ground level. So you may hear that a hospital is a trauma 1 or a trauma 2 or a trauma 3. It actually goes all the way up to 5, but it's the first 3 that are important to know about. So a trauma level 1, where are my notes, is probably the most comprehensive. They will have 24-hour general surgeon. They will have all the specialty. They will have anesthesia and so forth. A lot of these people are just round the clock. So let me go through this. On a level 1, a trauma surgeon's response time is 15 minutes. So if he's taking a nap, he's waking up and he's getting to it. We start there. Trauma level 1 is going to have a trauma team. Of course, it starts with the trauma surgeon, but it will also provide the respiratory team, the nursing team, and so forth. The trauma surgeon is dedicated to a single trauma. So if there's another trauma, somebody else is on call. The 24-hour ER doctor is always going to be there at a trauma center, trauma level 1. They have to have a neurosurgeon that can get there in 30 minutes. They have to have a cardiothoracic surgeon that can get there and be on call 24 hours a day. So there's another thing too. Trauma centers have to support at least 1,200 traumas a year in the United States. So if you're in a very rural area, you're probably not going to be a trauma center, because they will go to a more populous area, like, the city or the county, where there's more access to it, because you do have to meet that 1,200 patient a year goal. And that's an average. I think different states may treat it slightly differently. So anyway, so trauma level is the most comprehensive. You have to have orthopedic surgeons, cardiothoracic surgeons. The response time has to be between 15 and 30 minutes. Anesthesia, 24 hours a day, on call. Who else is on call 24 hours a day? Cardiothoracic, 24 hours a day. Your surgeons have to be board certified surgeons. OR ready. Within 15 minutes, you're bringing the patient in. So that OR team is ready. Radiology, CAT scan. Everybody's got about anywhere between 15 and 30 minutes for a trauma one. Patient to nurse ICU has to be at least 1-to-1, no more. You can't have 2 patients. Let's see, respiratory therapy around the clock. Well, that's pretty, if it's an acute hospital, they have respiratory around the clock. The ER even has their own respiratory designated tech usually. They have to make publications. So they have to make 20 publications a year. They have to have a research lab, and they have to have a minimal trauma admission of $1,200 a year. Okay, so what's trauma 2? Trauma 2 is very, very similar. They just don't usually have the research and publications required. So they're very similar in that they're going to have a trauma surgeon on call. They're going to have a response time of 15 minutes for that trauma surgeon. They're going to have a 24-hour ER physician, neurosurgery, ortho, cardiothoracic, all of that. They're very, very similar in that respect. What changes the trauma 1 and the trauma 2 level is the requirements for 20 publications and doing research. So if they don't have a research lab and they're not doing those publications, they become a trauma 2. But they will take the serious traumas in those. They're just known as a trauma 2. Now, trauma 3, there's a significant difference. Trauma 3s will take heart attacks and fractures and accidents, but not the trauma level. What the trauma 3 has that maybe the 4 and 5 do not have is that they have the ability to transport patients to the next level, to the trauma 1, trauma 2. If they, oh, hi, Gollum. Gollum is saying hi. What's your floating policy for travel nurse? It's not my policy, but I'll talk to you about that in a minute. So trauma 3 is not at the level that the trauma 1 and 2. It's not that comprehensive where they have everybody on call or everybody available 24 hours or ready in 15, 30 minutes. They're pretty good. They have an OR staff within 30 minutes. They have an ER doc. They may or may not have anesthesia. But they do have, what they do have is the ability to transport. So they either have a helicopter pad or they're in close proximity to a trauma 2 or 3. So that's your trauma 3. And then 4 and 5 are a little less, provide a little less of those ER needs. And then keep in mind too, there are specific trauma 1s and 2s for pediatrics that just pertain to pediatrics. So good to know. Just thought I'd mention that since we're talking about ER nurses and so forth. So what else do we want? Oh, let me talk to Gollum about policy real quick. So good to hear from you, Gollum. Sorry, I should apologize. This is the Travel Nurse Channel. My name is Rita. I'm usually here every Tuesday and Thursday from 2 p.m. to 3 p.m. I was tardy today because something went awry with my system, and I had to get the tech in. It took them almost 15 minutes to fix it. So I'm not sure what happened there. What about triage? Somebody anonymous is saying, what about triage during COVID? Sure, I'll get to that. I just want to answer Gollum's question about floating. Generally, ER nurses do not float to other departments unless they have those skills and they've used those skills for at least 1 year within the last 2 years, or maybe they have to have 2 years. So generally ER nurses are experienced in ER, maybe trauma 3, maybe trauma 2, maybe trauma 1. You know, that's something that will come up when you try to get your travel assignment. I'm an ER nurse and I'm accustomed to level 3 and 4, so forth. Or I'm an ER trauma nurse and I'm credentialed and blah, 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 and I've worked ER 1 and 2 for the last 5 years. So whatever your skills are, that's where you will go. And so you will only float within the emergency department. The emergency department can be divided into more like their urgent care, you know, the lacerations, the fractures, some of those things. The cardiac could be patients coming in with chest pain and so forth. Somebody's walking heavy around the house. It's probably my daughter, and she's not a heavy person. She's a heavy foot. So the flow policy for the ER nurse, if they are essentially full-time ER nurses, and that's where their training is, they will just stay in the ER department. They will float to maybe their urgent care, you know, admissions, triaging, and so forth, but they probably will not float to telemetry or the critical care unit unless they also have that skill and it's current. But generally, most travel assignments and travel contracts do require floating. So you have to be very, very understanding of that the hospital has that need to float you, and make sure that you are comfortable in wherever it is that you float to. So for example, an ER trauma 1 nurse will probably, any ER nurse has to have some pediatric background. But if she's only been working, say, in a lesser travel, like a lesser trauma center, like a 4 or 5, some of those don't have pediatrics at all. They immediately go to a hospital that does have the pediatric ER. So if you're an ER nurse, you might want to ask that based on what your skill is. If you have taken care of pediatric patients, or if you haven't, and how current is it? Because they usually want your experience to be at least 2 years, and they don't want it to be 10 years ago. They want it to be pretty current, which is better for you, better for the patient, better for the hospital and the travel company. You know, a good fit, right, is a good thing. So, so that piece is important. So the anonymous question was, what about triage during COVID? I'm not sure what you're saying about that. Triage is that initial assessment, bringing a patient in and so forth. So everybody's wearing their protective equipment, and you would float in between the triage and then just having your patient care, or maybe working in the urgent care section of the ER. Depends on the size of the ER, size of the hospital. But yes, a travel ER nurse would probably do triage because that's part of an ER RN's duty, okay, to be able to triage. Because you have to, triage is evaluating. So I tell you something I am very aware of. Aside from trauma gets big priority because those people are very critically ill. Those are your gunshot wounds and your terrible accidents and your knife wounds. And I'll just tell you a story about one. But so triage is assessing. What is it? I have a fever, my ear has been hurting me all day and all night, and I can't sleep and so forth. That's more urgent care, okay? So you put them second, bring in the next patient. They have chest pain, they're short of breath and so forth. You fast track them. So that's triaging. That's assessing who gets to go first and why. So bleeding and trauma and heart attacks, front of the line. You know, pain and earaches and so forth is, you know, of course they're concerned about you and they want to help you, but you can wait. Unfortunately, you can wait. They may give you some ibuprofen. They may, if you have, you know, pain in your neck or something, they may give you an ice pack. that's for the triage nurse to determine. So yes, travel nurses will do triage. I was going to tell you a story. Yeah, the really critical, the really terrible things that happen in the ER happen regularly. On any given shift, you can see as many as 200 plus patients. So again, just depends on the size of the hospital, the size of the community, but that is not a crazy figure to expect to have 200 patients go through your ER. And how many nurses are taking care of those 200? Maybe a dozen, so there's doctors, nurses, EMTs, God bless them. Some of those EMTs are so fabulous. They know how to splint. They know how to do so many things. So my friend, and then other team members are assigned to ER duty. So they will get their patient load, and they will also say you're on call to the ER. And that could be a critical care nurse. Well, an ER nurse is a critical care, but it could also be an ICU nurse that is assigned into the ICU. She could be part of the code team. So if somebody can't breathe or their heart stops and so forth, that nurse may be also coming to the ER to assist. If you're a respiratory therapist and you have some patients in other parts of the hospital, oh, Gollum, what pay travel nurses? Okay, so Gollum wants to know which states pay the travel nurses the most. We just talked about that recently, but and you know what? That can change from moment to moment as well. But at one point, I'm pretty sure Oregon was high on that list. But New York is high. California is high. Massachusetts is fairly high. I hope I'm not leaving anybody out. But I totally focus on that in other videos. And but keep in mind, California, San Francisco, and New York City are really big cities in the States. And yes, they pay the most, but the cost of living there is higher. So, there's a balancing act. And then do you want the city? Do you want to be touring the city? Do you live far away? So you think, I'll go to San Francisco. Los Angeles pays very high. So California has some really good rates in different parts of the state. New York City, that's off the top of my head what I'm thinking. Oregon was high up there at one point. I'm pretty sure Massachusetts. I know there's some surprises in there. I think Ohio pays pretty high too. So, yeah. But keep in mind that some of the places where the pay rates are higher, it's because the cost of living is higher, and that's what they have to pay to get you there. So, yeah, that's part of it. I mean, there's a lot of factors, the need, the time of the year, et cetera, et cetera. So, where was I? What does an ER nurse do? A travel ER nurse. But let me also say, you certainly deserve a week of appreciation. I hope people are showing you appreciation, because I do want to talk about some of the stressors of being an ER nurse. And then I would add another point for being an ER nurse and being a travel ER nurse. And we'll get to that and why. So let me give you an idea. Let's talk about the average pay for a travel ER nurse. Again, it can vary based on location, on need. Is it crisis? Is it the right season? Traditionally winter and flu season and so forth. Right now, I would say COVID is an ongoing season. Kind of goes up and down all the time. But on average, about $26,500 for a 13-week assignment. It could certainly be $36,000. It just depends. But I just don't want to. That's an average. That's taking into consideration states that pay higher and cities that pay lower or higher and so forth. But you can expect to at least make that $26,500. That's about an average for 13 weeks. And that is, the stipend for housing, or maybe you don't need the housing, and a whole bunch of other things. So you're going to be renting a car, you're going to be walking and so forth, but that's your average take home. But it includes some of those other pieces that may or may not be taxed. So, untaxed money is like more money in your pocket. So there you go. Okay. What kind of shifts do ER nurses do? They do every shift you can think of. They can start at 5 in the morning. They can start at 7 in the morning. They can start at noon. They can start at 3 p.m. They can start at 4 p.m. They can start at 5 p.m. They can start at 7 p.m. They can start at 11 p.m. And more often than not, they're doing 12 hours. So if you start at 11 p.m., you don't leave the next day till almost lunchtime. You start at 11 p.m., you leave at 11:30 a.m. the next day. And in addition to that, you may have overtime. It's really tricky in the ER. It's not like, everybody gets their dinner, they get their medicines, they get their treatments, they're supposed to go to sleep. The ER is not like that. It's like Las Vegas. It's like it never sleeps. So, if a patient needs a lot of rest, they're not going to get it in an ER. Okay, and what kind of duties does an ER nurse have? And that's an interesting question because it is probably the most varied set of duties that a nurse can have. Because a labor and delivery nurse, for example, it's pretty clear what she needs to do. She needs to monitor that patient closely, look for changes in her labor, and so forth. It's very, very specific. The ER nurse can be like a first aid nurse, treating lacerations. She can be like an EMT. She needs equipment, or she's used equipment, and there's only 2 in the unit. She needs to clean that equipment. She's faced with dealing with toxic things. She helps anesthesia. If the patient is a trauma patient or whatever reason they need anesthesia, she's exposed to a lot of things, some of them hazardous, some of them typical, like bodily fluids. So they do the non-clinical things, the cleaning up of patients, their lacerations, their injuries, and then it gets more and more intense. They start IVs, they administer IV fluids, they administer almost every medicine, drug you can think of, and every which way, orally, by mouth, orally, subcutaneously, intramuscular, deep muscle, intravenously, jugular. I mean, they administer a lot of meds. They give administrative fluids as ordered. They can treat with non-narcotics, or they could treat with serious narcotics where they really have to monitor respirations and oxygen very closely. They could give ice packs. And a lot of times some of these things are being assisted by an EMT, but if the EMT isn't there and that's what they need, that's what that ER nurse is doing. So they do a variety of tasks for young and old and in the middle, and they do the critical things too. They deal with, I was going to tell you that story, accident victims, gun wounds, prepping for surgery, resuscitation, intubation, the full gamut. So my friend, I talk about her all the time, and today's her surgery day, so she's in my heart all day. I didn't even think I was going to be here, but I was with her the last 2 days, and we had a great time, great visit, and her husband's with her all day. I'm on call, so I was able to be here with you. But at any rate, she's a respiratory therapist, a wonderful respiratory therapist, and a patient came in recently with a stab wound to the mouth. So his tongue, it was a lot of blood, blah, blah, blah. He was able to write, "I was stabbed in the mouth and I can't breathe." He was able to write that. And so as soon as he hit the ER, they did a tracheostomy, and she was there to assist with that. So, so a lot of bloody things, a lot of bodily fluids, a lot of horrific things, multiple motor vehicle accidents, falling off buildings, cracked skulls, you name it. I know some of the EMTs coming into the ER are going, "We have a scoop and run, we have a scoop and run." Obviously, it's a trauma or somebody, in very desperate state of health. And yeah, so they deal with a lot. They deal with a lot of duties. A lot of duties those ER nurses have. What else can we talk about? We talked about pay a little bit. So for 13 weeks, at a minimum, at least $26,500. That's the average across the nation. I'm going to read you a definition by the American Association of Critical Care Nurses. That's the AACN. And they are kind of the think tank for critical care nurses, the big cheeses. And per the American Association of Critical Care Nurses, they define critical care nurses as those advanced care RNs who care for patients who are dangerously ill or suffering from life-threatening injuries, usually found in hospitals, ICU, and ED. So is an ER nurse a critical care, an advanced care RN? Yes. Is she considered a critical care nurse? Yes. So we've talked about pay, shifts. We talked about shifts, right? They can be anywhere from noon to noon the next day or 11 to 11 the next day. Let's talk about how it feels to be an ER nurse. And if there's an ER nurse out there that catches this video, we're here every Tuesday and Thursday. It's mostly me. I try to get guests, but it's tough. It's tough. They're not on my schedule, or they take a long time to get back to me. So hopefully, I've had guests before, so I'm going to try. But I'm going to invite you, if you're an ER nurse, and it's ER Nurse Week. It's ER Nurse Week. It's actually started the 11th, and it goes on till the 17th for 2020. So happy ER Nurse Week. I appreciate you. We all appreciate you. And I hope you get some free lunches or free dinners or ice cream sundaes, massages. People should be very appreciative of you. So there's a lot of great things about being an ER nurse, right? You're really, and it appeals to some nurses. It appeals to me, although I did very little of it. I did much more ICU, critical care. But it's the immediacy of things. It's the knowing what to do in certain situations, or knowing where to go when there's a situation that you know needs to go to another level. It's interpreting. It's fast-paced. And it's a lot of satisfaction in being able to work in that area and do a good job. Is it stressful? Yes. And so we'll talk about the is it stressful part, because it sure can be, and it sure is. Many shifts will leave you completely exhausted. If you're seeing potentially 200 patients, or if they're just even coming through, even if you've gone from 5, discharge 3, grab 2 more, I mean, it's just all day long. I'm not saying you're going to take care of 200 patients yourself, but your department is. That's an average figure. So, so sure, it can be stressful, but I think the more important thing, well, let's talk about some of the stressors, okay? Because there's not a great schedule in the ER, right? So patients are coming, going, getting better, getting worse, so you think you have your assignment of your 3 or your 5 or your 4 or your 5 patients, and you work with an EMT or maybe 2, and you work with a doctor, and you're a traveler. So you don't even know these people on your team. You are like on hyper alert. You're on hyper alert. You hope your EMT is in talking distance to you, right? You hope your doc is in the unit and not somewhere else. Didn't go drive and get a pizza. So you're a travel nurse, and you love it, and you've been working ER for years, but now you're in a new environment. You're not 100% sure of the culture. You know what you can do, but you're kind of like only just figuring out what your team can do. And do they really understand teams? So that's stressful, right? But it doesn't take long. I mean, a 12-hour shift, you learn a lot about yourself and others in a 12-hour shift. And so that can be stressful. So what you need to look out for. Any nurse, but particularly I like to talk to travel nurses because we're all about travel here on the Travel Nurse Channel, is to watch out for burnout. Okay, if you're feeling sick a lot, you're getting headaches a lot, you're not sleeping well, your temper is short. I mean, look out for that burnout. Look out. If nothing has any appeal, you're getting into a depressed state, watch out for that burnout because maybe it's time for a little vacation or a little, TLC, just you and your significant other or your favorite pet, just taking a walk on the beach, or maybe you need more than a day. Maybe you need more than 2 days. Maybe you need real time off. So watch out for that burnout. And you're a good nurse. You can work. You can do something else, right? You can do a triage on the phone. I mean, there's lots of things you can do. So take care of yourself. There certainly and sure is stress and burnout in this area of nursing. More than others, not necessarily, but it's there. You can expect to be on your feet a lot if you're an ER nurse. You can, if you do it for years and years and years, and my friends have, the lucky ones walk away okay. It just sort of depends on a lot of factors, your mom and your dad and your grandparents, your genetic. Are you more predisposed to musculoskeletal things? So those are some things that can happen. You can start to have bad feet or bad knees. You can have a bad back or a bad neck. So musculoskeletal stressors on the body, the physical things. You can have burnout if you're doing a lot, and particularly if there's a lot of heavy patients and you maybe do work in a trauma 3 or lower. So we start the most comprehensive, the most intense trauma is trauma 1. Trauma 2 is very similar without the research department and the publications. And then trauma 3 is a pretty high level ER with the ability to transport to the higher, to the other 2, to the trauma 1 and 2. So if you're in a hospital like that and you are seeing a lot of traumas each day and each week, you may be moving a lot of heavy patients and multiple. If it's a multiple motor vehicle accident, they bring 3 or 4 to your ER and 3 or 4 to the next ER, and you're helping move all these patients. So watch out for your back. Watch out for all those physical musculoskeletal assaults. And sometimes it's just over time. Sometimes it's just that you've been careful. You bend your knees. You get help. You do as much as you can to take care of yourself. But 20, 25 years of that, and somewhere you're feeling it somewhere. Your neck, your feet, whatever, your back, whatever. And then there could be stressors from the organization. We're talking about travel nurses. If you're not getting relief when you need it, if you're seeing things happen that you don't think is good patient care, where do you stand with that? Number one, I would say lean on your clinical managers from your whatever company you're doing your contract with. You should have a clinical resource person, and you could talk to them. That clinical resource should be your level or higher. So it might be another RN at your level if you're a BSN level or ASN or ASS. What is it? Associate? AAS, Applied Science. ASN, I think they call the 2-year nurse. The bachelor's, the BSN. And then the master's, advanced care nurses. Whatever level of education you have. Whoever is counseling you should be at your level or higher. So your recruiter is helpful with a lot of things, a lot of the details of your contract, the finances, how you get paid, et cetera, et cetera. But the clinical manager should understand the business of what you're doing, the techniques and the labor board things, the real technical things, the patient-nurse ratio, wound care, cardiac care, et cetera, like that. So if you're on assignment and they they didn't treat the cardiac patient in a timely manner. They made them sit in the waiting room for 2 hours. You knew they had all the signs and symptoms of a heart attack, and you were in triage, and they said, no, they have to wait. You know, that could be very, very distressing, because you know that they should be getting fast-tracked, and they've been sitting around for 2 hours while their cardiac arrest is, or their heart attack is progressing. So you do want to talk to somebody about that. I would say if it's happening while you're on duty and it's really a problem, you go to whoever's in charge and you speak with them. And if they're not understanding, you go the next level. You do that sort of chain of command, going from your immediate supervisor to the next supervisor, might even be the house supervisor, whatever. And if everybody just says, no, this is the way we do things here, and you feel it's unsafe, just say, I need to take a moment and call my clinical manager, because you want to stay calm and you want to discuss it with somebody. If maybe you're overreacting, maybe you're overtired, maybe you're on the beginning of your burnout, or maybe you're absolutely accurate and you need an advocate to step in for you and for that patient. Your clinical manager can help you discern a lot of those things. So that would be like an organizational issue. Psychological issues occur, okay, particularly during COVID. I can't tell you how many of my compadres and cohorts and things I've read, the blogs I've read, of how difficult and stressful it is during COVID, because a good number of patients, we're not just losing patients that are, you know, quite elderly. We're losing patients of different cultures. We're losing them at 28, 38, 48. They come in and they have problems, and you're doing everything you can, and the doctors are ordering everything they can, and you treat them, and you become dedicated to them, and some of them for months are being treated between the ER and the ICU. Well, they don't stay in the ER for months, but you know, they've gone from the ER to the critical care, and all your efforts are in vain, you know, or it's just very stressful. Or maybe, you know, there's one family member that you continue to communicate with before, during, and after the patient expired from the COVID, and you just don't know how to comfort them, or they're just too angry to accept any of your comfort. So very, very stressful. So, and this is not just happening in the ER. This is happening in the ICU. This is happening throughout the hospital, throughout the healthcare systems. A lot of stress on the long-term facilities to keep their patients safe. And so watch out for yourself, because you're no good to anyone else if you're not taking good care of yourself. So I'm not seeing anybody check in. It's almost 3 o'clock. I'm here every Tuesday and Thursday. The Travel Nurse channel is a resource for those who travel and those who hire travelers. And yeah, I need to get off the air when I can't really speak correctly. But we are a direct link between the travel employers and the travel nurses. So we want to cut down and create that link, because a lot of the advertisements and so forth and all these big recruitment companies are putting out multiple needs, but they're not specifically seeing you, and you may be filling out lots of questionnaires and profiles and so forth, and not really knowing specifically where a job is. So on the Travel Nurse channel, we'll have advertisers, we'll have recruiters, we do have, and we will have more as we go on, where they can see you. So sign up for the Travel Nurse channel if you're a nurse, if you're a therapist, if you're any of the allied staff, surgical techs, radiology techs, respiratory techs. Oh my gosh, the ones who are really working are nurses and respiratory, without a doubt. Radiology, they never sleep. Lab, they never sleep. Some of the ORs slowed down because they needed to focus on the COVID patients. But I think that's turning around a bit. And there are a lot of surgery centers. So, you know, people that need their surgery need it, you know. If they don't need it, if they can postpone it, you know, maybe a nose job, I don't know, you know, fix your skin, fix your hair, whatever. Some of those things can wait. But my friend, for example, who has to have a lumpectomy and lymph nodes looked at and so forth, that's critical. You don't sit around knowing you have some cancer somewhere. You take care of it. And she's early stage. She's going to do great. So I love you, honey. I'm thinking of you. But a lot of the ORs in the initial stages of COVID, to protect the patients, to treat the patients that were coming in droves, they needed that OR space. And so a lot of surgeries that weren't absolutely necessary at the moment, there was a cutback there. So, okay, I go on in all these directions. I hope I answered some questions, and I will see you Thursday. And maybe we'll talk a little bit more about our wonderful, wonderful ER staff during ER Nurse Week, which is a week to specifically appreciate emergency room, emergency department nurses. You guys rock. You rock. Okay, I'm going to sign off. Thank you very much. See you soon. Huh. Couldn't get on. Now I can't get off. There we go.